There are 26 confirmed cases of monkeypox now in Canada. 25 of them are in Quebec. And in response, the province is going to start vaccinating some people with a smallpox vaccine to try to stop further infections.
We think it's a serious situation, but it's not the same as the COVID situation. It's not expected that there will be rapidly an upcoming very huge number of cases. So this is why we think that it can be eradicated.
That is Dr. W.H.O, the acting public health director in the province. He says the vaccine will go to those at high risk of contracting monkeypox, healthcare workers who treat them, or people who've been in contact with confirmed cases. Quebec has access to hundreds of doses, but will only allow for vaccination after a recommendation from public health. So far, no plans to open smallpox vaccines to the general public. So 25 confirmed cases in Quebec, one now in Toronto. Internationally, this is a story as well today as part of a global effort to control the growing number of cases outside where it is endemic in the west and central parts of Africa. It is into Australia, into Europe and North America now. The World Health Organization has just briefed reporters on these outbreaks and cases, and Rosie Burchard is on that story live with us from Brussels this morning. What have we learned from the WHO this morning, Rosie?
Well, WHO officials said this outbreak, this multi-country outbreak, is unusual, but they also were keen to stress that this should not be a cause of concern for the public. Dr. Sylvie Briand, who's leading the team there, said that in fact this is this is a disease which does not spread easily, unlike, for example, COVID-19. Now, officials say governments currently have a window of opportunity in these countries where monkeypox is spreading, but where the virus is not endemic, a window of opportunity to stop transmission. The curbs that the WHO pointed to included contact tracing, case investigation, and isolation. So that's the measures that the WHO is recommending currently. They also recommended that governments try to raise awareness among groups that might be more at risk with regards to transmission, for example, healthcare workers or lab workers. And they also encouraged governments to ensure to keep communicating clearly to prevent stigmatization.
So what are the officials recommending? I was mentioning the smallpox vaccine that in Canada they're sending to Quebec, where we have confirmed cases. What is the WHO saying in terms of vaccination and treatments for monkeypox?
Well, interestingly, the WHO says that the smallpox vaccine is not officially recommended for treating monkeypox, but it does say there could be some exceptions to that. They were quite unequivocal in the recommendation that there should be no mass vaccination rollouts at all. That is not their recommendation. Instead, they say governments, where vaccines are available, could consider vaccinating close contacts of those that have been infected and perhaps those that are more at risk. But they were also keen to stress that they believe most cases here will be mild, though research on monkeypox should be accelerated. That's according to WHO officials.
Rosie, thank you very much. Rosie Burchard with the international situation. She's live in Brussels.